Welcome back to the show, everyone. You know, when it comes to advancing heart surgery, innovation is in action at MemorialCare Saddleback Medical Center. I'm pleased to have Dr. Timothy Lee with me here today, cardiothoracic surgeon. He's going to tell us everything we need to know about robotic heart surgery. Welcome, Dr. Lee.
Thank you, Bree, for inviting me. I'm extremely pleased and excited to reach out to our community here.
Yes, well, you've got some very valuable information. We were just talking about some of the points we're going to discuss before we went on camera. Before we go there, I'd like the audience to learn just a little bit more about you. What are your backgrounds and your experiences?
Thank you. I'm a cardiothoracic surgeon, meaning I operate on the heart, and I've been doing this for over 10 years. I grew up in the Bay Area in California. However, half my life was spent on the East Coast, Midwest for training, as well as for practicing cardiac surgery. As I mentioned, I've been doing this for over 10 years.
Dr. Lee, let's start with something that is truly innovative and groundbreaking, and that is what you're here to discuss, robotic heart surgery.
Thank you. Yes, our team, including myself and Dr. Asad Shah, have built a robotic surgery program for hearts over the last 4 or 5 years. And in fact, we are the exclusive place that does robotic heart surgery. There are no other places in Orange County that does that.
What about outside, like in Northern California or other states?
There are places.
Is there anybody keeping up with you?
There are places that are keeping up with us. However, we have looked at our data and we found them to be superior to many of the other nationally known robotic surgery programs.
And you said you and your partner have built this.
Yes.
Fascinating.
Yes, Dr. Asad Shah is one of the most innovative heart surgeons here that we've brought to Saddleback to perform these operations.
Wow. So what are the benefits? Talk to us about.
Absolutely. For us surgeons, the robot allows us to visualize the heart better and to be able to perform these surgeries with more precision. For our patients in our community, there are smaller incisions, there's less pain, and the recovery typically is much faster with these robotic surgeries as opposed to our typical sternotomy approaches where we open the chest. So our patients are being delivered more expedited care. And as our patient population ages and grows, we're finding that they're preferring these less invasive approaches, and they're recovering faster as a result of it too.
Absolutely, I would think so. So doctor, what are the conditions of the heart that would require robotic surgery?
Thank you for asking. So robotic surgery requires a special selection of patients who have the right anatomy as well as the right heart disease to operate upon. So typically what we operate on with the robotic program is people who have valvular problems. So the heart is made out of 4 chambers, and within those chambers there are valves that allow the blood to flow in one direction. However, sometimes these valves become leaky or they become stenotic, meaning they don't open and close properly. And when that happens, people develop problems such as heart failure, where they can't breathe well, they have swelling in their legs. And so with this robotic approach, we're able to usually fix the valve or perhaps replace the valve if it's necessary. We can also use the robot to fix holes, small holes in the heart that can't be fixed otherwise. And we also remove tumors of the heart too through this same approach. We're also doing ablation procedures with other procedures that we do of the valves. Finally, we can also do certain bypass surgeries where there's a blockage of the coronary artery, and in order to get blood flow to that artery so that the heart gets more blood, we can bypass using the robot. Again, it's for certain patient selection. We can't do it for everybody. Sometimes they require a different operation, but being able to give this option to our patients is what I think community needs here.
Absolutely. So how are you going about inserting, because I'm assuming that it's through a camera, right? You're operating through a camera, right?
Right. So
and the robotic is working through that.
So the traditional open heart surgery requires a bigger incision. With this robotic surgery, we put these small ports in where we'll allow the robot and the cameras to go through. And these ports are about 1.5 centimeters in size. And they're typically on the side, across the rib spaces. So when people recover from this operation, they have these very tiny scars. There are 4 or 5 of them, but they're so small that most people don't even notice them.
Probably just kind of blend in with the skin after a couple
do,
of years,
yes.
I would imagine.
Yeah.
Because the old school thinking about open heart surgery is you're left with a long scar, a long recovery time, and that just isn't so much the case anymore, is it?
Right. Some of our patients are leaving within 3 days after robotic heart surgery.
That's fascinating. Medicine has come so far.
Right.
Let's talk about atrial fibrillation. It's a condition that I hear about often, but tell us more about what you're doing with that.
Right. Most people in the community probably know about atrial fibrillation. Most people have had friends or they themselves have atrial fibrillation. It's an abnormal rhythm of the heart. Usually you expect the heart to have that lub-dub, lub-dub. With atrial fibrillation, people have symptoms of palpitations or fluttering where they feel their heart rate is going very fast, like their heart's coming out of their chest. And they can get short of breath or they can get very dizzy or fatigued because of that. Atrial fibrillation becomes more prevalent as you age. As we age, our heart gets slightly enlarged, and that causes the rhythm to become abnormal. So, in fact, about 1/3 of people who are in their 80s have atrial fibrillation. Most of the time, we're able to treat it medically. But there are people who don't tolerate those medications, or there are people who still have atrial fibrillation even with the medications. And if they're a good candidate, they can be a candidate for various ablations that we at Saddleback have. In fact, with Saddleback, we have one of the newest generation PFA ablation systems that probably only 1 or 2 exist in Southern California. So we are very pleased to offer our patients that. Myself, I oftentimes do surgical ablation. So it's a bit more invasive than what our PFA ablation is. However, I'm still able to do it through very small incisions, similar to our robotic approach. I use a camera and we're able to make a tiny incision about 1 inch in size, just right down here in the belly to do our ablations. So we are pleased to offer that to our community here too.
Is that something that our community needs to be aware of if they have an irregular heartbeat or they're feeling maybe lightheaded, maybe when they're out playing pickleball or golf?
Absolutely.
Do they need to take those symptoms seriously?
Absolutely. So when someone develops atrial fibrillation, first of all, they can't do the things they want to do. They can't golf. They can't play pickleball because their heart's just racing.
And so the symptom is what you said, is just the irregular heartbeat, beating fast, feeling like the heart's coming out of the chest.
Right.
So those are some of the symptoms to look for.
And those symptoms are limiting their ability to do activities. But in the long run, if we allow atrial fibrillation to continue on, what can happen is they can develop heart failure, where their heart no longer functions properly, and the symptoms become chronic. And as a result of that, their longevity is shortened tremendously.
So it's really something that you want to stay on top of.
Absolutely.
So tell me, what is plating of the sternum?
Good question. So as I mentioned, there are certain patients who can go through robotic surgery. However, there are patients who have such complex heart disease where robotic heart surgery is not an option. And so we still have to go through the breastbone in order to get to the heart to fix those various problems. In fact, probably 80% plus of our patients require some sort of approach in that way. The greatest fear that most people in the community have, and something that I would like to educate them about, is how their recovery is. Now with our newer technologies, with this new plating system that we are going to talk about, we're able to have our patients recover much faster than they traditionally have. And so there was this thinking, if I had open heart surgery, there would be a big incision from my neck all the way down to my belly button. Nowadays, I'm able to do a smaller incision that's about 4 or 5 inches in size here. And so there's less of a cosmetic appearance of the scar. In fact, a lot of my patients are able to wear V-neck t-shirts and they don't even see their scar. In addition, because we have to go through this bone, the traditional way of closing it, we're pinning wires in. However, that would cause the bones to jostle up and down, back and forth. With our newer technology plating system, we are able to create something called rigid sternal fixation, meaning we're able to, using plates and screws, just like any other fractured bone, keep that bone intact as it's healing. And people are able to recover much faster as a result of that. There's less pain, there's a quicker recovery, there's less bleeding. I've noted that people don't have any pain after 3 or 4 days after this operation because of these plating systems. And so people are able to get back to their normal life much quicker than before when we had older technology to utilize.
Fascinating. I want you to come back and talk to us every 6 months.
It would be my pleasure to educate our community, to talk with you. I would love to talk more about the many different things that we have to offer at Saddleback, which we didn't have before.
Well, it's amazing, I tell you what, and you being on the ground floor and cutting edge of all of this robotic stuff. It's exciting.
It is, and I'm looking forward to treating our community.
Yes. Dr. Lee, thank you so much for joining us today.
Thank you, Bree.
Cardiothoracic surgeon, MemorialCare Saddleback Medical Center. You're watching This Day on Village TV. We'll be back after these messages.